Okay, guys, now I want to talk about bulimia and the diagnostic criteria for that. Before we get started, though, I would like you to take a look. It's about 15, 16 minutes long, documentary in brief, a segment called What's Eating You. And it is about a 21-year-old model in Los Angeles, and she talks about her experience with the binge purge cycle of bulimia, which is a really core component of it, although not the only component of it. But I would, excuse me, I would love it if you would take a look at this documentary in brief. This, like I said, it's just a short segment, relatively speaking, about 16 minutes long. And that will get your head into what I want to talk about regarding the diagnostic criteria for bulimia nervosa in the DSM-5. So take a look at that and then meet me back here on this slide so we can talk about these criteria. The binge purge cycle is a very core, important component of bulimia nervosa, and it separates it in part from anorexia, although it's not the only difference. As the individual, the model in the documentary segment I asked you to take a look at mentions, the binge purge cycle can become overwhelming in an individual's life. So binge purge, two pieces of this cycle. Cycle implies it repeats itself, right? So the binging part of this recurrent episode that happens again and again and again and again, the binging part is an out-of-control, almost frenzied intake of excessive amounts of calories, and these foods are typically high-sugar, high-fat, comfort types of foods. So you may remember this when I talked about binge eating disorder, because the binge part of the let's try this again. The binge part of the binge purge cycle in bulimia is the same as the binging in binge eating disorder. It's this out of control, frenzied, excessively high caloric comfort food intake. And for it to be diagnosed in the DSM, bulimia nervosa, this binge purge cycle involves recurrent episodes of this binge eating that I just mentioned, at least 2 times a week, although it's often more. And then that's accompanied, followed by the purge component of this recurrent cycle. When you purge something, what do? You get rid of it. You get rid of it. So as you can imagine, then the purging piece of the binge purge cycle in bulimia nervosa involves an attempt to get rid of all of the excessive high-fat, high-sugar calories that the individual took in that frenzied, out-of-control eating. Now, in this binge purge cycle during the binge phase, just like I mentioned to you when I told you about binge eating disorder, we're talking about between 3 and 5 times or more caloric intake that a person would need to maintain body weight and homeostasis and bodily functioning in an entire day is being taken in one binge episode. So this could be up to 10,000 calories sometimes in a binging episode of high-fat, high-sugar foods. Just to give you something to compare that to, an average height, average weight woman needs approximately 2,500 calories to maintain homeostasis and weight. A little bit more than that if she exercises frequently or is involved in activity that burns calories quickly, like marathon training and things of that nature. But still, 10,000 calories is far in excess of what somebody would need to maintain homeostasis and healthy weight. So we have this cycle of out of control, excessive caloric eating. And I say out of control because individuals suffering from bulimia nervosa will say when they're involved in the binging cycle, they feel out of control. They feel they can't stop themselves. They feel out of control and they cannot stop themselves from taking in this excessive amount of comfort, high fat, high sugar, high densely caloric foods. Densely caloric meaning in a very small amount of the food, there's a lot of calories. This is not uncommon in high fat, high sugar foods like cookies or cakes or cupcakes. Just a couple of them, you've taken in a lot of calories. To get diagnosed in the DSM-5, the binge purge cycle has to happen at least 2 times a week, at least at minimum, for a minimum of 3 months. Okay, so you have this binging followed by compensatory behaviors to purge or get rid of the calories. We call it compensatory because individuals are trying to somehow compensate for or correct for the binging. They want to get rid, because once they come down from that sort of frenzied, out of control intake, guilt sets in. Excessive guilt and shame sets in. Now think about this, because this is very different than what I said about anorexia. People with anorexia take pride in their ability to restrict their food intake and to get so thin. And remember, they feel it is a mark of accomplishment and achievement and an indicator of self-control, and they derive their self-worth from it. This is very different than what happens in bulimia. In bulimia, after the excessive intake of high calorie, high fat, high sugar food in an out of control binging episode, excessive guilt and shame sets in, and the individual often feels depressed, anxious, bad about themselves, very low self-worth, guilt, low self-esteem, shame that they couldn't control themselves. And they want to get rid of all of these excessive calories because they also have a fear, and this is similar to anorexia, they do also have a fear of becoming obese. And now they're thinking, oh my God, I took in all these calories, I'm going to gain weight. I've got to get rid of this. The form that the purging takes varies considerably. And more than one of these is often used by individuals diagnosed with bulimia. So anything from vomiting that is self-induced, which is extremely dangerous if it is repeated, and we'll talk about that in a little bit. Laxative use, which makes the person go to the bathroom. Diuretics, which makes them urinate. So defecation and urination to try to get rid of the waste associated with the food, or enemas to make themselves go to the bathroom. Excessive exercise for those who have purging subtype of bulimia. Excessive exercise and fasting between binges. So these individuals, after they undergo an excessive caloric intake during a binge cycle, they will try to compensate and get rid of the weight that they took in and allay their guilt and shame and their fear of obesity by either excessive compulsive exercise, so that's part of that secondary exercise addiction associated with eating disorders, and purposefully fasting between binges, so excessive intake and then eating nothing for days at a time. Excessive intake and then eating nothing for days at a time. There is also a non-purging subtype wherein individuals don't engage in excessive exercise or fasting between binges, but do the other things to try to get rid of the calories they've taken in. One of the main differences we see in terms of looking at a person with eating disorders is people with anorexia, when you look at them as the disorder has advanced, they look excessively underweight, dangerously thin. When you look at people with bulimia, they're typically either normal weight or somewhere within 10 pounds of their expected weight. The reason for that, and even some are slightly overweight, the reason for that, in part, is that you really can't compensate in any effective way for taking in upwards of 10,000 calories each binge. Laxatives, diuretics, enemas, by the time those are taken, a lot of the food has been absorbed in the system. You're not literally getting rid of all the food when you go to the bathroom. Vomiting, same thing. A lot of that has already been, at least part of what you've taken in has already been digested and distributed throughout the body. So you're really not getting rid of what you've taken in. Fasting between binges shuts your metabolism down. And so these binges and then not eating, binges and then not eating actually slows your metabolic rate. So it's more difficult to lose weight. So bulimia typically results in being somewhere around the expected weight the person would normally be, because, and if anything, a little bit overweight, because those excessive binge episodes cannot be compensated for in terms of releasing the calories from the body. I want to point out again, as I've said throughout this discussion, during those binge episodes, people describe it as a frenzied, out of control eating process. They really don't feel like they have any control. It's a frenzied experience. They do have, just like people with anorexia, people with bulimia have excessive concerns about body weight and shape. And they, just like people with anorexia, evaluate their self-worth either exclusively or excessively with regard to the way their body looks and the weight that they are. Now, one very important difference between bulimia, nervosa, and anorexia is what I told you on the last slide. The difference between ego-dystonic and ego-syntonic. So whereas anorexia is ego-syntonic, and you know what that means because I spent a lot of time on the last slide talking about it, bulimia is ego-dystonic. People with bulimia know their eating patterns are out of control during the binge cycle. They know that their eating patterns are abnormal. They know that the purging and the attempt to compensate is problematic. And if anything, they feel extreme guilt and shame after these binge episodes. And they're frustrated that they can't seem to control their eating. So this makes bulimia, at least according to some studies, easier to treat than anorexia, because we're starting with an ego-dystonic perspective, wherein the person is bothered by the eating patterns, bothered by the outcome, and motivated to change it, unlike people with anorexia who think their restriction and their emaciation is a sign of accomplishment. Okay, I will meet you on the next slide. Think about that stuff. Think about the difference between the two, ego-dystonic, ego-syntonic. What are some of the similarities between people who suffer from anorexia and bulimia? What are some of the differences? Think about that before you meet me on the next slide.